Well, for more on this, I'm joined now by Dr. Unni Krishnan, the Head of Disaster Risk Management at the development organisation Plan International. This is a worrying development, isn't it?
Absolutely. We are talking about a deadly disease, which is the most virulent disease known to humankind. It started several months ago, started in one country, has been steadily spreading to the second country, the third country, and recently, during the weekend, the first case reported in Nigeria. So this is a very worrying situation, and it must be taken very, very seriously.
What should medical staff do to prevent it spreading further?
Yeah. This is a disease that doesn't have cure, and there are no vaccines to stop it. At the same time, to prevent the spread of the disease is no rocket science. Through simple health messages, reaching out to the vulnerable places where the disease is unfolding, and most importantly, covering the whole population through such health messages are key, because the only way to stop deaths and spread is by containing the spread through proper public health messaging, so that people have better awareness about it and they are able to prevent it.
What are the simple messages you need to promulgate to everybody then?
The first thing is, when people come in contact with people who have been infected, including those who have died from infection, is something that should be stopped. That's the most important thing. And in parts of Africa where during the last rites and ceremonies for the deceased is happening, people often hug, they touch, and it is through such contacts the spread.
So they must not touch the deceased at all?
That's absolutely right, because the disease spreads through bodily fluids. So that's
right.
One thing. And the second, also in crowded places, it spreads to bodily fluids. So in crowded places, that's one of the reasons one of the governments have banned people coming together in large numbers in some of the places. That's the third thing, proper hand washing and other sources through which people could be getting it.
But that's, as we know, I think, from all our own lives, that is something. It's one thing to give that message. It's another thing for an entire population to have to listen and then take heed of that message, isn't it?
You're absolutely right. We are talking about countries which has got some of the weak health systems in the world, and which their health systems are already stretched their limits. And with this outbreak, they are crippled. And for agencies such as Plan International, we have been in the forefront in all the three affected countries, Guinea, Sierra Leone and Liberia, ever since outbreak started. So it's becoming very difficult. For example, we have stopped the movement and travel of our own staff to some of the remote pockets where we work. We work for children's centers, and our own regular normal work has been impacted because of this outbreak. But we must take this outbreak seriously. That's where stopping people from coming in contact with people who have been infected is key. I
guess that's difficult, isn't it? You've got to get governments on board to try and say to people, actually, you can't travel. The free movement of people around a continent or around the world must cease. Otherwise, more people will die.
Yeah, the movement of people who have been infected or possibly suspected with infection, that must stop. That's very important. And we are talking about countries where people have been moving very easily across borders, the three countries, which is Guinea, Sierra Leone and Liberia. But the last case that has been reported, the first case in Nigeria, is a different story. It came through someone who was traveling in an aircraft. So it has been moving beyond borders, not through the usual ways.
I mean, it sounds dramatic. Would you recommend all aircraft should stop travelling between countries?
No, that's not what we're talking about. There's no need to panic, but it's an important and a serious outbreak that must be taken very seriously. This is where stepping up support. So Plan is calling for a global, let's say, joint action to deal with this outbreak. It's important that the countries that are impacted are provided sufficient both technical and financial resources now, so that they can stop the further spread. And it's not just the four countries. We're also talking about other countries in the region who have got equal fragile health systems. So that's where providing support now will help them to prepare better and stop the spread. It's in the best interest of the world to start acting now.